This is Jeremy with CryoClarity, and in this video we're going to be going over the sternum as well as the different vertebral levels. Some of these sternal landmarks are found and other structures found at one of these key landmarks as well. So the sternum is separated into three different portions: the manubrium of the sternum, the body of the sternum, and the xiphoid process of the sternum. And each of these are either associated with the spinal level or have bony landmarks associated with spinal levels. So looking at the manubrium, the most superior aspect of the manubrium, we have this jugular notch. That is that notch in between your collarbones that you can palpate just on the inferior aspect of your neck, kind of below where most guys would find their Adam apple. We can actually feel this jugular notch, and another name for this jugular notch is the suprasternal notch, the notch above the sternum. The notch on the most superior aspect of the sternum is known as the jugular notch or the suprasternal notch. And lateral on either side, left and right of this jugular notch, we have clavicular notches. These clavicular notches represent the articulation point, the clavicle will articulate with the manubrium of the sternum, forming sternoclavicular joints on the left and right side, commonly known as our SC joints. And these SC joints anatomically are classified as a synovial joint, and the type is a saddle joint. Functionally, they're classified as a diarthrodial joint. Therefore, the sternoclavicular joints, made up of the sternal end of the clavicle articulating with the clavicular notch of the manubrium, form a synovial saddle-type diarthrodial joint. And within this saddle joint, there's a fibrocartilaginous disc. Other than the jugular notch, we also have the sternal angle, also known as the angle of Louis or manubriosternal junction. This represents the junction between the manubrium and the body, hence manubriosternal junction, and it also is known as the sternal angle or angle of Louis, and this is found at vertebral level T4, T5. So the jugular notch is found at vertebral level T2, whereas the sternal angle, aka angle of Louis, aka manubriosternal junction, is at vertebral level T4, T5. And the xiphoid process, which is one of the three parts of the sternum, is found at vertebral level T8, T9. So the way we remember the vertebral level that these different bony landmarks are found at is that starting on the most superior aspect with the jugular notch, we have T2. You multiply that by 2 as you go down, and we get 4. So T4, T5 represents the sternal angle. Multiply that by 2, and we get T8. So 2 times 2 is 4, times 2 is 8, and T8, T9 is where we find the xiphoid process.